Show. I'm Dr. Kasey Holland, the host of our show. The Made to Heal show dives deep into the hidden obstacles that keep people sick, stuck, and searching for answers. From chronic infections and viral reactivations to environmental toxins, burnout, emotional stress, and nervous system dysregulation, we explore the complex roots of illness that conventional medicine often overlooks. Through honest conversations, patient stories, and interviews with leading experts in functional and integrative medicine, you'll learn what it really takes to recover your energy, clarity, and vitality. This isn't another surface level health podcast. It's a journey into the real mechanisms of healing, empowerment, and transformation. Because you weren't made to just struggle, you were made to heal and thrive. I'm excited to have Dr. Michelle Eisenmann with us today. Hi. Thank you for joining us. We have such a great episode ahead. Dr. Michelle Eisenmann attended Parker University, where she earned her doctorate degree in chiropractic, her master's degree in clinical neurology and fellowship. Additionally, she is board certified from the American Chiropractic Neurology Board. She has a bachelor's in kinesiology from the University of North Texas. She has special interests in neurological studies with an emphasis on neuroplasticity, traumatic brain injury, post-stroke rehabilitation, vestibular dysfunction, dysautonomia, and movement disorders. Due to her own health and family history, Dr. Eisenmann has a passion for healthy lifestyles. When she is not working at the clinic, she assists people with brain injuries by teaching them how to live a lifestyle that is supportive to recovery through an online coaching program called Brain Charge. In her free time, she enjoys spending quality time with her husband and daughter. Being born and raised in Puerto Rico, Dr. Eisenmann offers services in both English and Spanish. Thank you so much for being here today.
Thanks for having me.
I first want to get started by hearing how you got into this field and all of these really profound specialties that you provide patients.
hmm Yeah, so I, much like many practitioners, I'm sure you could probably relate to this. Like, there's been multiple things kind of pointing you in a direction, right? So I know that for me, it began with my own family history. So I have a family history of Charcot-Marie-Tooth. And so that is a peripheral neuropathy. It's technically said that it's one of the most common peripheral neuropathies, but no one really knows about it. And so there's a lot going on in there. So my mom had four sisters, and three of them have the neuropathy, and it was suspected that my grandfather was the carrier or also had the genetic predisposition. Following that, my mom was a four-time cancer survivor. And so she had two cancers before I was born, two cancers after I was born. And she, I kind of grew up being like daughter and caretaker because, and I will give my mom my props. She most of the time behaved like a person that wasn't handicapped or had any other issues. She was one of those people that people would learn their history and they would go, "How are you here? How are you doing all these things?" She was still a wonderful, wonderful mom. And then um, around the time that I had to choose what do I want to do with my life, I started realizing that it just wasn't enough to watch my mom kind of go from, appointment to appointment, and I'll see ya in a year and I'll see ya in 6 months, but nothing was happening in between. Nothing was happening in between. And so when you are given a terminal diagnosis or you have a, you know, peripheral neuropathy like hers that was considered, it is considered genetic. um, it's almost like people forget about you or practitioners forget about you and that you still have to do things in life. It's not like, oh, that's it. Just live your life and do your best. And so I didn't find that satisfactory for my mom because I was with her in the day to day. And so I can see function decrease. I can see things, year to year to year. And so I wanted to go into neurology for sure. And I, you know, was going to different doctors and kind of looking at what they were doing. And what I found is that they were not treating with the tool set that I wanted to treat with. And I just want to disclaim that there's nothing wrong with like being a medical professional because I feel like sometimes we get stuck in the loop of like tearing each other down, and it's like just people with, specific skill sets trying to help other people. And so I quickly discovered that medicine, or traditional medicine, pharmaceuticals was not what I wanted to do long term. And I found something called functional neurology. And I saw this boy online that was a soccer player, and he was hemiplegic after a while, which means half of his body was working, half of his body wasn't because of a traumatic brain injury. And so, as I started to look at that boy and I saw the news, kind of TV news article, um, I saw that these doctors were doing non-invasive therapies. And being from coming from like the lifestyle of my mom, that she had to suffer a lot through therapeutics that were very invasive and having to bear witness to that. Um, I thought it was incredible that there was a non-invasive option because I didn't know it existed because we were never told about it. And so I started investigating more, and then I saw that that kid went back to playing soccer. And I was like, how does a hemiplegic kid all of a sudden go back to playing soccer without getting tortured? And so I was like, okay, I need to find out more about this. And so one thing led to another. It kind of, I look back at my life and I feel like I've had little tidbits throughout my life leading me here. My grandfather was a Korean War veteran, and he had traumatic brain injury from an explosive or multiple explosives, let's be real. And so I have the genetic component. And then myself, I was a cheerleader and I didn't realize that I had a concussion because my bar for healthcare was so low. It was like, if I don't have cancer, I'm good. And that was not the case at all. So I really truly had to learn like what is health, and I didn't realize how much I didn't know what it was and what a standard is, and it's not just go in, take this, you're done, and what maintenance, management, nutrition, movement, and when do you make decisions for more aggressive intervention and when don't you? So that is kind of a summarized version of what I would say led me to functional neurology. Now, I know I have my doctorate in chiropractic, so some people get kind of confused about that. And so my doctorate is in chiropractic, but I have an additional license, and I do have to do continuing education for both licenses,
Okay.
which is fun, which is fun. Um, in the American Chiropractic Neurology Board, so it's called DACNB. And not all chiropractors are DACNBs, but chiropractors can become DACNBs. So that is kind of, I guess, what you would call a specialty training. And you do have to sit for a board. You do have to take, written and practical type exams to be able to acquire it. But at the time, I I didn't know any other profession that was doing this. So I kind of just took a leap of faith and I prayed and I said, you know what, God, like if you want me to walk through that door, then open it wide open. And he has tendencies to shut doors very fast and open doors very fast too. So I'm like, can you creak the door? Doesn't have to be that dramatic. And so I applied to Parker. I got in. I never looked back. And I went in straight because I want to be a functional neurologist. That's what I want to do. And along the way, I fell in love with, the things that make a person live. And so, really, parts of chiropractic, parts of nutrition, parts of, oh my gosh, like we are made to believe that lifestyle and all of these things are separate from healthcare, and they're not. They are the foundation of healthcare. And so, yeah, so and I still ended up doing the rest of it, and here I am now, and I've just been blessed with connections, and God has really truly opened doors when He's needed to. So,
Incredible. Yeah, that is a really inspiring journey. And there's just something about when your profession and really your purpose comes
Hmm.
from, your family or your own experiences because I always tell people, I'm like, well, it's not just something I learned in a textbook. It's like I can spot the flavor of the fatigue that person's feeling or what that person's going through because I've felt it. And so I think it's just such an amazing asset that you have to provide to patients and other providers like myself when we connect like this. So we were brainstorming about, what to cover because there's so much that we could cover here.
Yes, there is.
But let's just start with traumatic brain injuries. And
Yeah.
I know that you look at them a lot differently than conventional medicine does, and that just because an MRI or a CT is clear doesn't mean that somebody is healed. So why don't you
Hmm.
kind of just summarize for us, things that people need to look for or maybe be aware of that, they could have been checked as all clear from an injury and they're not.
Yep. And this is kind of one of my favorite topics because this is something I personally struggled with. Like,
Mm,
as I got into this profession, and I almost felt betrayed by my healthcare providers because I was always told, oh, you're fine, you're fine. And I was not fine. I was not fine in many different ways. And what I came to understand about traumatic brain injuries, and first I want to take the word trauma away from it because that psychologically puts an image in our mind that whatever you consider traumatic then must be a brain injury. And that's just not necessarily true.
mhm.
So let's talk about brain injuries, right? So who has a brain injury? I think we both have toddlers. And I think we've seen that like it's confusing. Now it's not the same for toddlers because you can't really injure things that don't exist yet. But um we see how much they hit themselves and you're in the trenches right now in the oh my God, don't touch, oh my God, don't climb, oh my God, the and so what I like to relay to people is we're not very different from toddlers. We're not very different. We just have more mature neurological processes. But when we suffer injury, even if you don't consider it to be injury, that is still something that needs to be checked because our brain is not an organ that we can visualize the same as a finger, the same as, we can do lab work for a heart, we can do lab work for the pancreas or anything like that. So it needs to be assessed. And there's a lot of different things. Now, who can get a traumatic brain injury? Anyone, and what is required to have a concussion, which is classified under traumatic brain injury. A concussion is a synonym to mild traumatic brain injury. So you have your mild, moderate, and severe. So, yeah, there is a difference in between a head penetrating wound or maybe a veteran that has been exposed to a sequela of brain injuries through blast exposures. But even the typical day-to-day person that maybe have just played sports or had a motor vehicle accident, or honestly, you slipped in your shower, really, it could be that simple. We still have to check the integrity of our brain because it's not so much did I have an injury is how did my brain recover? How resilient was my brain to that? And how what was my nutrition at time of injury? Am I male, female at time of injury? Am I going to be, was I in a high stress mode at that time of injury? That all is going to dictate how brain injuries recover. And so I want to always get people's minds away from like, well, it's not a traumatic-ish injury, so I must be okay. I want people to start thinking about their brains in the sense that, well, I go pretty much most of the time, well, most people should go every 6 months to their dentist to make sure they have good dental health or they at least see them yearly. Why don't we treat our brains the same way? It is the operating system. It's one of the first things when we come to life. It's one of the last things to go. when we die. So we need to make sure that our brains are operating at a high level, and it's not always at a pharmaceutical aspect. So this is where my call is to other practitioners for collaboration, because a traumatic brain injury, a concussion, really fits in the rehabilitation model, because we have to relearn how to do things. We have to relearn how to connect these things to happen. So once a person has been established and been declared that they are not in an acute state, or they're not, at risk of death for a brain bleed or something additional, then that person should have a referral to something like what we do. And it sometimes happens, right? Because there's a lot of value in OT, there's a lot of value in PT, but there's also a lot of value in functional neurology, and you see how these professions kind of blend in together. And recovery from a brain injury, depending on your severity, can be long-winded. So it's not so much who am I going to work with? You may work with all of us at some point in your recovery, because no profession is an end all be all.
Mhm.
But that is kind of my thought process on, traumatic brain injury. Is not so much, I don't want people to think about, well, it's when a cell goes into inflammatory mode, and it's more, we all have injury. If you had a knee injury, you know that you're not going to run a marathon all of a sudden a month after injury, but we don't treat our brains that way. We have an injury, or we have, God forbid, menstruation, or we're postpartum, or something additional happens, and we expect our brains to perform at high level performance. And so I would say, does that answer that question kind of? And if I haven't, I can kind of
Yeah,
move it
I
out.
think one thing that you really highlighted well and that we're going to dive deeper into is that it's not just structural. Like it's not
Hmm.
just, oh, there's a bleed or not, or swelling or not, or you actually hit something. And I remember myself learning this through seeing patients where, you know, um, all of a sudden they have Lyme disease and it's like out of the blue. And they're like, there's no tick bite, there's nothing. And then we're talking and I go, okay, well, walk me through like what you were doing before this happened. Like, was there anything? And sometimes it just doesn't come up because again, they just don't think of it until second or third visit. And they're like, well, I was in a car accident, you know, or something like that. And so the other piece of this is that injury
Hmm.
causes so many more disruptions than just that physical impact of, you know, how your blood-brain barrier is functioning, how your
Hmm.
immune system is functioning, because your brain is connected to all of that too. And so I really like that you do work with veterans because I'm sure that you see this too, where it's like, and you talked about this, how when it matters what mental state they were in when they were injured. And then with veterans, there's also typically a layer of toxins that can also impact the brain. So, this idea that it's just physical trauma is a whole other thing, I think, um, which obviously physical trauma is bad. But if they had all of these other things in their history, like maybe an infection or toxin exposure, stress, whatever, then when they have an injury, it also can magnify all of those things. And all of a sudden, you have somebody that has, all these disruptions. And so, the way that you're talking about addressing all that holistically is, I think, so important. I'm really
Yeah.
excited that functional neurology is amazing. I did my undergraduate studies in neuroscience and had planned to go more into neurology um, before I got led this way. So I actually led more back into brain health with just the recent research that's come out about Epstein-Barr virus and how it is associated with some of these autoimmune conditions and brain health, which we can talk about later. But yes, what you're saying is really how all medicine needs to head.
Hmm.
Obviously, there's a time and place for that acute injury where you need to go to the ER, you need to get an MRI, CT. But beyond that, yeah, like we have to look at all factors. So why don't you kind of share with us some of the treatments that are different with functional neurology and what that looks like for patients?
Yeah, so this will be fun. This will be fun for you because this is where we talk about neurodevelopment. And so people get surprised when we go into the office and we show them their diagnostics and some of the metrics that we use to help relay them to understand what their current neurological function is. And by that I mean, clearly the way that motor movement, coordination, reaction time, um, eye movements, all that stuff, cognition, balance, vestibular function, all of that can be related to brain function because our brain is the one that actually performs those activities, right? And so um, neurodevelopment fits in beautifully because you see that brain function from beginning to pretty much maturity, right? And so you start looking at eye movements and how your baby's developing those eye movements and how eye movements and neck mobility proceeds, maybe sitting and that proceeds standing and then that proceeds toddling until we can do certain things. And so all of the therapies are congruent with those kinds of functions. And I put that because I think when people hear the word neuroscience, it sounds grandiose. It sounds big, but you can have a very big piece of equipment like a gyrostem, which is a very eye-catching one that we have that makes you look like you're going on an astronaut ride. Um, to do some vestibular rehab, or something as simple as a popsicle stick with targets on it. So, really, some of the therapies that we have to offer are for neural timing, balance, vestibular function, various different kinds of red light therapy, a lot of electrical modalities kind of in the world of tens that kind of help upregulate information from nerves to brain. So it's a lot of brain to body and body to brain kind of connection. And who gets what therapy and when, this is the best part. It's dependent on you, your findings, not a protocol. It's what do you need at that point. So I just told you that I had stopped with a patient, and so we do have a TMS machine. And so that was, first thing that she did this morning. And we did something like that, but then we do whole body vibration. And so people don't assume that these things can kind of go together, but it's the beauty of functional neurology is not always, sometimes it matter what you're doing, but it's not always what you're doing, it's how you're doing it. What is the frequency? What is the intensity? What is the kind of movement? Is it quality movement? Is it unquality? So that's why it's really important sometimes to like work with someone because when you have a brain injury, your perception and your reality are skewed. And so you're working with someone that can give you additional feedback. So feedback like treatments are the ones that really move the needle. And so that kind of segues to what we just talked about. This is why I see that a lot of the pharmaceuticals aren't getting patients where they need to be in recovery from brain rehab, from brain injuries, because it's like having electricity in a plug and never turning on the light switch. And
Mhm.
so if you don't activate, if you don't stimulate, if you don't move in the right thing, you're not going to. So it could be something as involved as, we have our Virtualis, it's the VR kind of headset, and that's becoming very popular in the neuro rehab world. But we also have gait training, which is just stand up and let's learn how to walk. For some people, that's where they need to be because they may think I walk all day, every day, I'm fine. And then I look at their gait pattern and I'm like, no, you're not.
Mhm.
No, you're not. And so every therapy, anything from VR world, vestibular, that TMS, electrical modalities, chiropractic, has been actually incredibly beneficial because sometimes we think we can move in a range of motion when we don't. And
Mhm.
I will say, people ask me all the time, what is like out of all the fancy equipment? Because right, functional neurology offices are kind of like that. They just have a lot of cool tech, right? And they always ask me like, what is the one therapy you would do for the rest of your life if you were stranded in an island? I always say chiropractic,
Mhm.
hands down, because spinal mobility is the foundation to independence. If you can't move your spine, you're dependent on other people. And if you're dependent on other people, that means you're not moving, you're not exercising, you're not feeding yourself correctly, etc.
Yeah, amazing. That's it's just so great that we have all these options now. Um,
Yeah.
what in your practice have you seen? Do you see TBIs and chronic infections or post-COVID? Do you see that play into how somebody's recovering? Because I think we're in this, we're going on 6 years out from COVID now and s- starting to kind of have an understanding of, okay, this is how it really is impacting us long term. What does that look like in your world?
Yeah, so a lot. And I always try to not open that Pandora's box with a patient if I don't have to, because I'm also not in love with like doing every test under the sun. I try to be very particular because if you're talking about a person with a brain injury, it can be kind of overwhelmed sometimes to do all of it. But sometimes we really have to open that. So I guess as an example, I have a patient right now and I can know exactly at what point we need to do more investigation that I was doing therapy with. And if we go back to that light switch analogy, if you kind of have electricity in a plug and you flip on that light switch, well, you're activating, things should improve with consistent feedback. If you're flipping that light switch on and nothing, it's like the lights are on but no one's home kind of situation, then I have to look back at metabolics and I have to look back at blood work and 9 times out of 10 I'll find some kind of chronic viral or bacterial infection. And so I like to view it in this way. Our immune system is really awesome at function or immunological health. And when it is overwhelmed and overridden with either one, it's going to tell the other one to go away. So in your world, a TBI makes you so much more susceptible to acquire an Epstein-Barr virus or a Lyme disease or a cytomegalovirus, right? In my world, um, it can be either or, right? A person may have had that and then they had it, but it was dormant. Then they had a traumatic brain injury. That immune system plummeted. That blood-brain barrier is open now. And it's like they're called opportunistic infections for a reason. They're like, ooh, opportunity, let's go. And so I see that a lot. I have a gentleman that I knew there was something else going on. And so there are some infections in there that are leading to cerebellar autoimmunity for
Mhm.
him. And that has been a direct correlation after his traumatic brain injury. And so even though you do see improvement with therapy, because
Mhm.
there's no one size fits all approach, we've tried to do stuff like that, and it really is person to person. He is seeing improvement in therapy, but I want that improvement to be long lasting.
Mhm.
So we're going to eventually start working on trying to lower that cerebellar autoimmunity and see what we can do about those viruses and kind of receptor-based issues long term. So he's not doing therapy, riding a wave of good, then getting bad. So that's also kind of a recommendation I have to people. If you're working really hard to get better, and it all almost feels like you're walking a tightrope and you step off and you can't get better, you want to look at other infections and bacterial infections, teeth, lungs, bladder, etc.
Mhm. Absolutely. Yeah, and you mentioned that long term, like that's the goal, right? We don't want somebody to always have to go see you. We don't want somebody to always have to come see me. We want that infection to be well controlled. We want them to be thriving. So when it comes to brain health, what are some practical things that we can all do, on our day-to-day basis to really tap into taking care of it? Because like you said in the beginning, I think a lot of times we don't even think about like our brain and how hard it's working. And also the most my most favorite thing about the brain is its neuroplasticity. So
Yeah.
literally you can always improve your brain health. Like there's something that you can always do, no matter
Hmm.
how bad things are, you can always do something that's going to benefit it. So yeah,
Hmm.
there's some recommendations that the average person day to day can do for their brain health.
So practically, that I'm gonna give you guys, and this is gonna you're gonna be at the edge of your seat, and then you're gonna be like, oh, that's it. So practically, the one thing that you have control on a daily basis that gets to set you up for success is blood sugar.
Mhm.
So I have a hot take. I do not think that fasting, and I don't know what your hot take is on that, so if we're not in the same page, but I do not believe in intermittent fasting or fasting for people with a traumatic brain injury that have uncontrolled blood sugar. It is not a one size fits all approach, and hopefully there are benefits to fasting, but we need to get neural circuits, we need to get immune health, we need to get other systems in line for that fasting to be very beneficial. And so, really, blood sugar regulation is the one thing that I know so many people that are cold plunging and doing like, I'm going to brush my teeth with my right hand and tomorrow with my left hand and single leg stands and the exercise regime and taking creatine. And I'm like, but none of that matters if your blood sugar is unregulated. So, number one, it would be that, and I stress this because I can't tell you how many times I talk about it in the clinic and I sound like a broken record until it finally like clicks.
Mhm.
Like, oh, so really eating just oatmeal and then skipping lunch and having dinner is not okay. I'm like, no. So really, like, food is incredible. We all know Doritos are not good for you. We all know inherently whole foods are better for us. So that's a telltale right there. We can always finesse those things with a practitioner. Um, but blood sugar is number one, and number two is follow the sun. Follow the sun. So, I know that for some people that are night workers or, new moms or whatever, that may not be like the thing, and things happen for a season sometimes. But if you start pairing your activity level with the sun, if you start pairing your ambiance at home, I mean, I don't know if you can tell, like I have a literal lamp in here, rather have some extra actual light, but we try to avoid overhead lighting when the there's differences outside in my house. Um, Really, when the sun is gone, we pretty much are in red light, like crazy bats. So, which I believe was the reason why my daughter slept so early. But really, that's the big thing is follow the sun, which Dr. Huberman does a great job talking about in the million podcasts that he has. And then blood sugar regulation are the two biggest things because once again, you can be doing everything else under the sun, but if you don't have that, and what are the biggest ways to tell if you don't have a continuous glucose monitor that you have unregulated blood sugar? Do you get hangry? Do you get sleepy after you eat? Or do you wake up in the middle of the night to go pee? So if you have any of those symptoms, then you know your blood sugar is unregulated, and we need to look at how we're fueling ourselves and how we're eating and what does your plate look like? Is it more carbs on accident or you know, did we indulge in a sweet and kind of improve our fats, fiber, and protein? There's a reason why the ketogenic diet is so popular in the Mediterranean diet for brain health. And it doesn't mean that you have to live in that diet forever, but for seasons, you may have to.
Mhm. Yeah, I mean, there's the obvious metabolic reasons for controlling blood sugar, but also when blood sugar crashes and you're low and you're hangry or whatever, it's really important to understand how your brain and your adrenals are processing that because they think you're starving and go into a stress mode that is the same fight or flight system as when there is a threat. So I see this a lot in people that, well, with TBI too, like your brain also is trying to always protect you and make sure that it doesn't
Thank you.
get
I say
injured.
that all the time. It's your best friend. It loves
Yeah.
you.
So if your blood sugar is dropping and you're taking yourself out of a, safe state, your body is going through that stress state. And that has lasting effects. Like it's not just the effects that happen while you're hangry and hungry. It's your adrenals got stimulated and released cortisol, and there's downstream effects. And then, oh, you didn't sleep good that night. And so then your brain, your lymphatic system didn't get to fully function and it snowballs. So I think that's a great one. I know when a lot of times in complex chronic illness too, people think that the most important piece is just whatever, antiviral, antimicrobial, this or IV that they're going to do. But it really is those daily practices that are going to result in them improving and not having to continue those or have
Yeah,
flare-ups or whatever. So yeah, I think that's really, really important.
because like you said, your brain loves you. So our bodies, for those people out there that say our bodies naturally detox, yes, you are right, but they can't necessarily do it if it's challenged. So why not remove the burden of the unregulated blood sugar and wacky circadian rhythm and allow your body to do what it likes to do, which is go back to homeostasis? And so people believe, like you said, that they have to be always taking an anti something, and that's just not always true. Sometimes it really is, let's figure out how we can get your body in a state that it doesn't have to fight that and see what happens. And then let's see what else needs to happen to maybe get you to cross that bridge if you're not crossing it. And it is incredible the amount of people that I've seen just from that. Man, they were like a horse, they weren't a zebra, you know? And
Mhm.
so, and how wonderful is that? I always, like I said, if I don't have to open the Pandora's box, I try not to. So, because that's a whole world in and of itself.
Yeah, I mean, I think we have something crazy like 72,000 different ICD-10 codes. And also, you can have all these long list of symptoms, right? We could touch on, I know you see patients with dysautonomia, and I mean, the symptoms, it's like A to Z. You can't even list all of them in a single visit. And it can be from something that isn't huge or if we change something then the body there could have been a lot of things going on but the body is trying to get back to homeostasis so when we regulate the things that we can control all of a sudden symptoms just start going away.
So, yeah, we should hit on dysautonomia.
Yeah.
So, one big thing about dysautonomia, it, and here's my view, this is, I believe, because it's a system, it's like, it's not I don't like to talk about dysautonomia the way that I would talk about Epstein-Barr. Like some, you can acquire Epstein-Barr, sometimes forever. And so sometimes you don't acquire Epstein-Barr. It's just not the same. This is a neurological system. So when people say, I have dysautonomia, a lot of the times there's confusion in I have this diagnosis versus what I truly have going on, which is needing some rehabilitation. And so, an aspect that is completely missed is if the autonomic nervous system is responsible for output. It's how am I going to do heart rate? How am I going to do respiration? How am I going to do, you know, pupillary dilation, pupillary constriction, etc. So it controls a lot of our body. But how does it do that output? How does it do that function? It needs integration from eyes, vestibular, and other kind of more neurodevelopmental type things that we talked about. So if your eyes can't track a dot, if you can't necessarily, and I'm not going to say balance in the sense that you can stand, if you do not have good vestibular function because you were tested through like an SOT platform, those are going to directly affect your autonomic system because the autonomic nervous system is also intimately connected with gravitational positioning. And so if your brain doesn't understand that this is up and this is down, and it's actually skewed, and this is your center of pressure, and then you feel all this kind of weight in your back and you slump all the time, and people are always like, hey, sit straight, sit straight. And you're like, I mean, I try, I just don't feel like I can. um, then you may be looking at some integration, sensory integration issues, and you may need to look at dysautonomia from the lens of a concussion or brain injury too. So there's that side of dysautonomia that people don't take any credit for, right? So they may be, it's not just about salt, it's not just about compression socks, it's way more involved than that. And are if we and sometimes I've seen people that have had, more viral type issues when it comes to dysautonomia, and that was more of a trigger. But it then started shifting eye movements, and then that added to their dysautonomia. So they had this lingering infection for a while. They didn't know about it, started to affect their neurology without the presence of a TBI because viruses can be considered acquired brain injuries. So that would be an ABI, uh, much like how hypoxia is an ABI or lack of oxygen. So as you go, down the rabbit hole, you start realizing nothing is segmented. So why do we have a finger doctor, an ear doctor, and an eye doctor, and they're not all talking to each other? Because not a single thing is segmented. And so that's the point I really want to drive with dysautonomia is that um, a lot of these cases can be rehabbed. A lot of these things can improve. It's a little bit of a wild ride because the autonomic nervous system does what? Parasympathetic or fight or flight. And if you're riding that seesaw, you're like, huh, huh, huh. So some people sometimes feel like they're on a roller coaster ride that they never asked permission to get on.
Mhm.
Um, but it can be rehabbed. And so um, there goes the aspect of immune health, right? Because when they're fighting off something from your camp, which is more of the EBV, that immune system says, I need to work, so function everywhere else goes down. And so there's a lot in the space. And I feel like dysautonomia is super confusing to people because they think heart, so cardiology. And I have worked with a lot of cardiologists like that. We have co-managed some patients, and it's fantastic. Do your due diligence, make sure you don't have anything else going on, right? Like an EKG wouldn't hurt someone, but it's very necessary to look into those things. So,
Yeah, I think what happens a lot is people are just overwhelmed by their symptoms and they want them to be validated and they
mhm,
want something that tells them what the heck is going on. So eventually they get a diagnosis of dysautonomia or POTS or whatever it is. And a lot of times in conventional medicine, it's like you have this, here's the couple medications that can make it, you know, less symptomatic. And that's just, it's like your identity. And a lot of times, rehab and looking at the more zebra-like things, isn't known or given an option. And so a lot of times, for me, it's like people have been sick for, 10, 15 years, and then they're finally like heard of something different or whatnot. Um, and I do think that that's changing and that collaboration is increasing. And I think that actually COVID helped bring light
I totally agree.
this, right? Like finally,
Yeah,
it's like, yes, viruses can present as a brain injury and it can affect your entire body and your nervous system. And so that's one like thing that I've seen come about is where patients are getting taken more seriously and more likely that things like functional neurology and rehab are being implemented. Like even in the conventional setting, I've seen some post-COVID programs and they are implementing physical therapy, occupational therapy more. We should absolutely have functional neurology added to that list.
I know. I know. So, and we're trying, right? Um, but yeah, I agree. And to that end too, I kind of want to tell like some dysautonomia like patients and concussion patients out there, like make your doctor work. Make them work. Don't just take a diagnosis, ask, and what do I do next? And if the answer is only a medication, you're allowed to ask because they are working for you. So ask them, is there any therapy I can do that you would recommend? Do you know of anyone? Your doctor is responsible for making connections with other practitioners to be able to best facilitate you with a referral system to know when do you need to go to someone else and when am I the one that's supposed to help you. They're not supposed to keep you forever because you're not meant to be kept forever. So um, that's my kind of big sense on that. Um, I see a lot. I mean, I feel like I don't go one day without hearing someone get diagnosed with dysautonomia. And I ask, like, well, what are they doing for you? They haven't referred me out. They haven't done this. They haven't done that. And they don't have any solutions for it.
Yes. So ask why. And I tell my patients this too, because a lot of times they'll say, well, it's because of this. I'm like, but why? Again, why? And I'm not to this point with my toddler yet, but I've heard that, children reach this point where they just go, why? But why? But why? And so I tell patients that too is you have to ask the why of the why. And that's one thing like in my world with opportunistic infections is the same thing happens where they're like, "Oh, well, I have this infection and that's what's causing everything." And I go, "But why is that infection even active in the first place? Because it's opportunistic." Um, so it's the same thing. It's why is this happening? What are the things that are actually driving that imbalance? Why is the body not in homeostasis?
Yeah.
Yeah. Well, thank you so much, Dr. Eisenman, for joining us today. Where can patients find you?
Coppell, Texas. And let me like make it easier for It's literally Coppell, Texas, but it's DFW. So if anyone's familiar with the DFW airport, we are literally 8 minutes away from it. Um, but yeah, it would be in Texas in a clinic called Resiliency Brain Health. We are a very open concept clinic, so we are very happy. If you call, you may feel like family. So please give a call to our clinic and give a chat. Don't be afraid to say like, "Hey, I saw this podcast. I just want to know a little bit more of." Even if you're not local, maybe we know someone around you that we can refer to. I know I refer a lot in Florida and North Carolina and California and stuff like that. So if you are local, please come in. I mean, literally just come in one day. We have an open concept clinic. They'll walk you around, tell you about it. But we're here to help, and also our online services, which are Brain Charge, and that would be info@resiliency.bh.com. And really, the Brain Charge was being offered for those traumatic brain injuries or brain injuries that don't have an ability or support to really leave the home very often, or don't have the ability to be in a place, or they're in a rural state that they have no other person around. So we just wanted to provide, at least the bare minimum that we know is going to get them to that next step that they need. So that's about it.
Awesome. Thank you so much for joining us, and I look forward to connecting with you in the future too.
Okay, sounds good.